Hi, I am with the lovely Janet Schloss. How are you, Janet?
I'm great. How are you, Leah?
I'm very good. And today we're talking about the HIV chapter, which is such a beast. Let's be honest.
Yes, it is. And I have to thank you because I only updated it from your chapter that you actually wrote, but it is a beast.
It is a beast because the topic itself is just so comprehensive, and so detailed and so complicated. And obviously such a very sad condition in so many ways. I mean, inspiring in many ways, but such a clever condition. My God, that's what I always get from it. I mean, there's no other virus quite like it, is there?
There's no other virus like it whatsoever. It's like so complex, and it like has this own little mind of its own. The medical fraternity have done a fantastic job trying to get their head around it and what they can do, to actually assist. But still, there's so much that's still unknown.
Absolutely.
And there's still so much stigmatism associated with it as well. I think that's actually the saddest part of it. I have so many friends who are gay or transsexual or interactive, and it's still a big thing that they talk about for it. So I think that we as a community also have stigmatism against it, and we need to know about it. And the virus itself, like you said, is so complex, but people don't want to tell you a lot of the time that they actually have it
Yeah.
because of that stigmatism.
Yeah. Yeah.
And
And I
that's
think
sad.
it's very, very sad. And I think that, one of the reasons why I've always made sure that we included the content around it, both because obviously people, if they're unwell, they'll have it. We need to be able to know how to support them. But I wanted people to have more understanding around it. And, the more you can understand something, the more you can remove the stigma and the more you can help. And, I'm sure you were looking at it as I did, when we looked at all the research around it. There's so much that we can offer. And the drugs only
Absolutely.
do something, but they're not actually fully eradicating it, and they're not necessarily improving quality of life. But it's the
I,
quality of life piece that I think that we run rings around it essentially.
oh, absolutely. And we as a naturopathic community, we have so much to offer people with HIV. And you know what? That's where I want to, like you said, is remove the stigmatism. Like we need to be telling these people we can actually help them, but it's also the naturopaths themselves feeling confident that they can actually do this, and that's the big thing. They think, oh, I can't touch people with HIV. I don't know enough. Well, read, learn about it, because you know what, we have, like you said, so much to offer these people, and they need assistance
They do, they do, and I
and understanding.
oh, absolutely. Look, I mean, I remember the first patient that I ever treated that had HIV. Probably the most that I actually contributed to their healthcare was just the compassion and the care. But then when you really start delving into it and you start looking at the research and start looking at the ways in which we can offer assistance, we can basically influence whether or not they turn into a person that fully progresses into AIDS, or whether they develop all the unusual cancers or immunological compromisations or all that sort of stuff. And why wouldn't you want to offer that to someone?
Oh, totally. I remember the first one I did as well. And he actually came down, he lives in Rockhampton in Queensland, which is very, if you know Australia at all, that is very country, very high stigmatism. He can't even tell people that he's actually gay and lives with his partner, and the fact that he would have HIV, he would be completely ostracized. So I know. And he had also then been diagnosed with cancer. So by the time he came down and we actually worked out, and actually helped him, and just to turn it around and have somebody who actually listened and said, we can do something to help, makes massive difference.
Yeah, no, absolutely. So much that we can do. And was there anything interesting that you found in the research as you were updating the chapters? Any new things that were coming out?
Yeah, it's amazing the advances in some of the drugs and the understanding of how that affects certain people. I think that in itself is really interesting. And, like any particular area, I think it's really, really important that we understand, where the drugs are actually going, what they actually do, how can we actually either enhance them or make sure we don't give stuff that actually stops their function
Yeah.
and stuff for it. I think that there's been, even though we don't hear about it as much, there's been so much advances in the research for HIV. And that's what said, like exactly what you just said, like if we can keep them in HIV versus then going to AIDS or the other cancers and the complications that they may actually have, how ideal is that? They can live their whole life with HIV
Yeah. Yeah.
and their quality of life is fantastic.
Yeah. And we can contribute to that, which I think is the best part of it.
Absolutely. And I should have just said, not only is it the research on the medicinal, like the pharmaceutical side, it's also the research that's going into naturopathic treatments. And that's how it has started to advance as well. You know, people are now seeing that this has got merit. So it's actually worthwhile doing like really good research into this to see how we can actually help people with HIV. And that's awesome.
No, it's fantastic. I think, you know, interesting times that we're in at the moment, obviously with all this virus stuff as well. You know, I think our understanding of immunology in the greater perspective as, you know, the medical communities is evolving. And, you know, certainly since I wrote the first version of HIV chapter in the CNM, you know, with all the PrEP drugs that people are now taking as preventatives for HIV, that's also interesting as well, you know, and just the idea of supporting patients that are on PrEP medications and helping them because they're in a higher risk exposure category, but to prevent actually, you know, acquiring the virus. So much that we can offer. And I think probably as well to reflect on is that whilst you can certainly be someone that is, you know, their specialty practices in an HIV community, pretty much everyone else's communities will have patients that will present for other variables, but also have HIV. And so the knowledge around being aware of what it is, how it works, how to work with it, I think we have to be really responsible for.
Absolutely. I would love to see more naturopaths actually take on the HIV area and AIDS type area. I know I've got some really good friends who are doctors and they specialise in HIV and in the clinics and all that type of stuff. But I only know like a handful of naturopaths who say that they specialise in HIV. So if we can have more people, because it's quite prevalent, who are very competent and understand and really want to help these people, this would be perfect.
Totally agree.
On so many levels.
Totally agree. Totally agree. Well, thank you so much for updating the chapter and adding all those amazing areas that you did, and obviously your contribution with both of your chapters. And I'm really looking forward to seeing how it upskills people. So thank you.
Thank you. Thank you for actually writing it and being so passionate. I love your work.
Thanks, Janet. Thank you.